I'm Bhavesh Taylor. I'm a second year medical student at Christ's College, University, Cambridge.
I'm Dr. Vijay Taylor. I'm a general practitioner.
At A-level, I took the usual science route for A-levels, so maths, chemistry, biology and physics. That's the typical sort of A-levels you do for medicine. You have to do chemistry and biology, and maths is also recommended, and most do another science or do a language or humanities. But usually it will be 3 science or maths A-levels and 1 other science or non-science A-level. I enjoyed all my science A-levels. They were hard, but also definitely useful for medical school in terms of the background of science, as well as being sort of trained to work independently and have a strong science background in school.
So I went to State Comprehensive School. And when I was about 13, 14, I had aspiration, desire to go to medical school and become a doctor. But I must admit, I wasn't very studious. I wasn't very conscientious about that studying. And so I did, at those days, did my O-levels and then A-levels. I didn't get the desired grades to go into medical school immediately. So I did a degree in biochemistry. At University of North Wales, and then when I completed was my 3rd year of my BSc, I still had that. There was still that desire to go to medical school, so I applied as a mature student, and I went to Leicester Medical School from there, and so that's the route that I had taken to become a doctor and go to medical school. Yeah.
It's a very structured route in this country, so it's a either 6-year or 5-year medical course. So everyone applies in UCAS in 6th form in upper 6th, and the course is set so that it's a 5-year or 6-year course. You apply via UCAS. You have to have the required A-levels. You have BMAT, UK CAT, which are 2 critical and really important exams that are taken in upper 6th. So it's a really structured, organised route to medical school. And I guess the course is laid out so that it's vocational. So obviously it's one path, and it's organised so that you have 3 years of preclinical sciences and 3 years of clinical sciences. So it's a 6-year degree and you graduate as a doctor after that.
I think for me it was that, the desire to, there's just like a cliche about, to help people, to help people in terms of, whatever their medical illnesses are, and to try and do good for society. One of the key things about going to medical school is that it's a vocational degree, so it actually trains you for a particular task and job, and I felt that was important in terms of getting some focus and direction early on in my career in terms of what I would like to do. So the desire to help the public, help society, the NHS, as we know it is, it is the best healthcare in the world. It's free for everyone. Everyone is treated equally and equal opportunities, and hence that was really the reason why.
When I was younger, perhaps I had other interests as well. I was strong at maths at school. Maths was my particularly strong subject, so I guess I did have interests in other subjects, but it was always definitely going to be a science background, a science subject at university. And medicine came from, I guess, from work experience, from working at various charities and voluntary groups and bodies, and that sort of grew from there really. And my interest in medical sciences grew. So it wasn't simply one sort of very sort of short-term like desire that came from nowhere. It was sort of a long-term, just sort of trying out different things, interest in science, meeting people in different healthcare professions, and various work experience as well.
I worked in factories doing sort of packing. I worked as a postman, delivering letters. I worked in a bakery. So I did various jobs as a student to just make sure that I had enough funds to keep me going for the year. Well, the career as a GP has changed over a number of years. The GPs do manage patients, obviously, from birth to death. That's how general practice has been, and that continuity of care is very, very important. But general practice is changing in terms of GPs are managing much more complex conditions and patients with long-term conditions than they used to in the past. So 20 years ago, if a patient was diabetic, the GP would refer that patient to the hospital for the diabetes care. That doesn't happen anymore. Primary care GPs manage patients with long-term conditions like diabetes, and so much more care for patients is done closer at home, is done in the community rather than in a hospital setting. And we have to be able to multitask. So for example, I see my first patients at 7:30 in the morning. So, and that the reason why it's 7:30 in the morning is because we have what we call commuter clinics. So patients who want to go and see the GP before they go to work. So I see a couple of patients at 7:30 in the morning, and then I start my normal surgery from 8:30 in the morning until around about 12 o'clock. Then you've got paperwork, you've got patients that you may have to visit at home, and then you start your afternoon or evening surgery again. So the day's continuous. People perhaps get the impression that there's a gap in the GP's day between lunchtime and the evening surgery. There isn't a gap, because you are constantly doing other things like paperwork, contacting various health professionals or patients on the phone, managing your practice, managing your staff, and so it is a really very full-on day. So I quite often don't get home until about 8:30, 9 o'clock. So in effect, I've done a 14-hour day.
First of all, to get into medical school, it's very competitive. There's normally, the current statistic is that 1 in every 3 applicants will get only 1 offer out of 4 choices. So only 1 in 3 will get in the end. That's how it is, really. So it's very competitive and very difficult at the same time. You've got to have the required A-level grades, at the very least all A's at AS, and to achieve 1 or 2 A stars maybe at A-level. You need to get the necessary marks in the entrance exams, so UKCAT and BMAT. You need some evidence of work experience and previous interests in the healthcare profession. Once you apply, there's the interview as well. They interview you as well, and that's very important to come across well to them. But the main thing is the competition, really. So it's not just what you need, but you've got to beat everyone else at the same time to achieve better grades than they do, or to achieve higher entrance exam scores. So that's very important. The course is 6 years, and it's very demanding. You're always tested. Every year you have more exams to complete. You've got to pass the exams. You can't... I think in medical school in particular, failing exams is the worst outcome, because really there's a thing called GMC proficiency, and you've got to meet that requirement to carry on to the next stage in your academic training or clinical training.
There are lots of sacrifices. I think the biggest sacrifice, I guess, is time, because so I spent 8 years so I qualified as a doctor in 1993, and that took so my time was 8 years from the age of 18 right up to the age of 22, 23. So it took me 8 years to get to that point. So that was the first one. It was and then obviously trying to manage the finances, and then clearly I had support from my parents, which was very, very important. because without their support, it would have been very difficult to sustain that level of expenditure without any income for 8 years. So there were sacrifices from that perspective. And then other sacrifices is really the time and devotion that you have to put into your studies. So, the medical curriculum it's very intense. It has to cover the breadth of the medical specialities. So, you do have to spend a significant amount of time studying, whereas some of your colleagues who are doing other courses perhaps get much more free time and much more social time. As a medical student, is less so from that perspective.
I find it very rewarding. It's definitely a hard course to complete, and it's a difficult. The exams are very hard. We do work very long days. So my normal usual day, maybe, for example, would be 3 or 4 lectures in the morning from 9 to about 2 or 3 o'clock, and then one practical session for 2 hours in the afternoon. I'll come back for maybe some food, and then go out again for what's called supervisions, which are small group tutorials, and they're really useful for going through sort of small parts of the course that are quite tricky. And the evening will be spent doing lecture reading, pre-reading, making summary notes, maybe socialising every few days, but really the working day is quite long.
I think first of all you need to be focused. You need to have that desire for quite early on, because it's changed from my time in terms of if you are planning to apply for medical school, there are a number of hurdles that you need to complete, and these you need to start working on. So from the age of about 13, 14, having to ensure that you fulfill those milestones that you're trying to achieve. So you need to have an idea, quite early on, I believe, now, compared to when I applied. When I was at school, you really, you did your O-levels, and then you, in your first year at sixth form, you applied for UCAS, put down your choices, wrote your personal statement, and then you waited to hopefully to hear about getting some interviews. But now, before you even get to that stage, you need to ensure that you've got some experience for your personal statement. You need to ensure that you've fulfilled some of the entrance requirements that some of the universities require, like UK CAT and BMAT, and so it is much more of a structured process for you to even get to that point of actually putting down your medical school choices on a UCAS form.